Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will continue our exploration of new laser treatments in cosmetic dermatology and skin rejuvenation. The unique aspect of tonight's program is that these lasers do not require the services of the doctor, but are performed under a dermatologist's supervision. Additionally, the laser and pulse light procedures we will show you tonight are non-invasive and do not require time off from work or normal activities during recovery. Tonight we will explore the use of the new Cool Touch laser that allows for improvement of wrinkles with no break in the skin or need for time away from work. And we will also check out the new Fotofacial intense pulsed light treatment that lets dermatologists take away facial and neck redness as well as blotchiness from rosacea and past sun damage. These new in-office laser type procedures can dramatically improve the look of your skin. In the pharmacy corner this evening, our award-winning neighborhood pharmacist, Bob Church, will update us about new breakthroughs in the treatment of painful migraine headaches. Are there ways to prevent these annoying, disabling headaches before they have a chance to begin? Well, we'll learn the answer to this question and others about migraine prevention in tonight's Pharmacy Corner. This evening's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. Eating undercooked chicken contaminated with Salmonella bacteria can make a body mighty sick. But Salmonella bacteria also has been shown to be a cancer fighter. And according to new research, when a genetically modified form of the bacteria is delivered along with radiation into mice bearing human melanoma, the two therapies appear to work together to produce a potent anti-tumor effect. The combination of high-dose X-rays and Salmonella delayed the formation of new melanoma tumors by up to 6 times over that seen in untreated animals, according to doctors at Yale University. Scientists showed that Salmonella appear to be as good at fighting their way into tumors, a property that could make the bacteria effective as both a cancer drug delivery system and as a lethal weapon in their own right. It's possible the bacteria could interfere with the ability of tumor cells to repair themselves after they've been exposed to X-rays, or that X-rays themselves could soften up the cells, allowing Salmonella to come in for the kill. A third possibility is that the presence of Salmonella might put the immune system on guard so that the body's been invaded, and that X-rays might make tumor cells more vulnerable to immune attack from the body's natural immune system. As of today, treatment for advanced melanoma is very difficult, and doctors continue to look for ways to fight melanoma. Right now, the best treatment for melanoma is prevention by having any changing mole or skin growth removed before it has a chance to become a melanoma. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in the pharmacy corner is our award-winning registered pharmacist, Bob Church, from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
Why don't we get right into our subject tonight and have you tell us about migraine headaches.
Okay. Migraines are a recurrent, severe headache, usually associated with a pulsating effect, nausea and or vomiting, visual disturbances. The episodes usually last anywhere from 4 to 72 hours. A lot of people with migraine headaches can know when they're going to be getting a headache because there are certain triggers that they become familiar with, things that elicit the headache, such as stress, foods, noise, glare, different things that they become familiar with so that they know when they're going to be getting a migraine headache.
And you really can tell the difference between like a tension headache and a migraine headache?
Absolutely. They're usually on one side, they're very pulsating, they're very intense, and they usually last much longer than just a normal headache.
And things like Tylenol and ibuprofen don't quite work for those?
Not very well, no.
Okay. So when are drugs needed? When do you have to resort to prescription things?
Well, people usually resort to medications in an attempt to stop the attack or abort the attack before it gets full-blown when they start to disrupt their normal function of life. And usually it's the severity of the headache which determines how incapacitated you are or how you can carry on with your normal functions. The kinds of drugs we use are things like Tylenol, aspirin, anti-inflammatory drugs, some antidepressants, narcotic pain relievers, the newest set of drugs like Imitrex that alter serotonin levels. Those are the types of drugs we use to try and deal with the pain or abort the pain.
Now, you wanted today to discuss the concept of prophylactic treatment, so
right.
Maybe you could clear that issue up for our viewers.
Prophylactic treatment is just that. It's a treatment. It's not a cure for the headaches. The goal is, by using drugs day in and day out, to try and diminish the number of attacks by maybe 50%. You're not going to get rid of the migraines entirely, and it's not an attempt to do that, but it's an attempt to get them to where your quality of life is better than it was before you started using the medications.
What drugs are used in prevention of migraines?
Actually, there's been a lot of drugs that have tried things like beta blockers, which are, as you know, and most people know, they're used for high blood pressure treatment, some cardiac problems.
Could you mention some names of those?
Sure. Inderal is one. Tenormin is another one.
Okay.
Those are two that are well known.
Sure.
Calcium channel blockers have been used, things such as Calan. People recognize Calan, Verapamil, Procardia. Those types of drugs have been used. Some antidepressants, some anticonvulsant drugs, but by and large, the most data and the most widely used are the beta blockers.
Are these drugs then used every day continuously so that people hopefully won't get their headaches? Is that right?
Absolutely.
Are there concerns about beta blockers? Because those are powerful medicines.
They are powerful medicines, and we know more about that group of medicines for treating migraine than we do any of the others because there's been more studies done, there's been more use. In fact, there's actually two drugs, Inderal and Timolol, that are FDA approved for prophylactic use in migraine. The problem with beta blockers is that you don't respond always to the first one that they try. It's usually a process of trying one to another till you find one that's going to be effective, and then finding the right dose is also critical. The onset of action, if you find the right one, is usually pretty quick. It may be a couple of months before you start getting really good diminishing of the episodes of migraine. There are certain people who can't take beta blockers, people who suffer from depression or some cardiac arrhythmias, people who have asthma or chronic obstructive pulmonary disease are not candidates for those drugs.
Okay. Calcium channel blockers, what's that like for patients? Are those
well,
difficult?
They are using them and have for the last several years, but there haven't been enough large studies done on those drugs yet to be conclusive as to whether they are as effective as beta blockers. Right now it doesn't look like that they are. However, we do see quite a few people who are using them. They seem to take longer to work. The time frame that you have to wait for them before you get good results seems to be longer. There are no FDA-approved calcium channel blockers at this time for migraine treatment.
Do you see your patients coming into the pharmacy ecstatic about controlling their migraine sometimes with some of these medicines? I mean, because these people suffer when they get these headaches.
Oh yeah, when they finally find a drug that will diminish those numbers of attacks, they get very edgy if there seems to be, like, let's say, a manufacturer problem in supplying a drug, or there's a temporary outage. People get very nervous because some of these people have tremendous headaches that put them in bed for 2-3 days at a time. And if they found a drug that reduces that, then...
So you see people having effectiveness from these
Oh,
things.
absolutely.
Are there other considerations to be aware of when using drugs to prevent migraines?
Well, yeah, I think so. I think that when you start these drugs, you have to start them at the lowest possible dose and titrate them up depending upon side effects and response to the drug. You also have to get away from relying on using other pain meds day in and day out, because that in itself can reduce the effectiveness of the prophylactic drugs. It also can sometimes elicit the migraine itself because it's like a rebound effect.
Oh, I see.
So you have to get away from doing that. You have to be patient, knowing that it's going to take a couple of months to get a good fix on this, and then if the drug isn't right, then you have to go through the process of trying another drug, so you have to be patient. And you also have to, at some point, stop the medication to reassess what it's really done. If your migraine situation is going to be better, do you need to continue the medications?
It's not easy.
No,
it's
it's
not an easy
not.
thing.
Not at all.
Yeah, because just think about going back to the doctor, discussing the dosing, getting the new prescription, whatever. It's a lot of work and not an easy thing. But
Yeah.
I guess if people are ending up in the emergency room having to have Demerol shots all the time, it's going to help. I would try it myself.
Oh, there's no doubt. I would too.
Bob, as usual, that was very useful and very important information, and I hope our viewers will discuss their questions about headaches with their physicians and pharmacists at their next opportunity. We look forward to you returning to the Pharmacy Corner on future programs. Thank you.
You bet. Thank you.
You're welcome. Now, on with the Medical Explorer. Let's focus tonight on some new non-invasive laser dermatology procedures that can rejuvenate the skin without pain or downtime from work. Tonight's procedures are unique, and they can be performed by specialized treatment experts who work with the dermatologist and not just by the dermatologists themselves. We will focus our attention on the Cool Touch laser that allows non-invasive wrinkle improvement, and the Fotofacial pulse light procedure that lets us remove facial and neck redness, brown blotchiness, rosacea, as well as sun damage changes. Let's begin by having you meet one of our popular non-invasive laser specialists, Leah Onstott, registered nurse, and learn about the Cool Touch laser and Fotofacial treatments. What's really exciting in modern cosmetic dermatology is the aspect of improving people's skin without invasive procedures. You've heard us talk for years about using lasers to take off wrinkles, the CO2 laser, the erbium laser, and we've shown great results in before and after pictures of how we can take away many, many years of aging. However, there's a definite segment of our population that doesn't want to have several weeks of healing or any downtime. So as technology improves and doctors and the laser companies learn about people's interest in procedures that don't cause downtime, they've come out with this new Cool Touch laser. And what the Cool Touch laser allows us to do is to improve fine wrinkles and early aging changes without downtime, without having to take time off work, without significant discomfort. Person can have the treatment done and be back to work or back to normal activities the exact same day that they have it done. We have a specialist working in our office doing these procedures. Her name is Leah Onstott. She's a registered nurse with many years of, she doesn't look very old, of course, but she has many years of experience in medicine and is really enthusiastic about these new laser procedures that she's involved with. The first one that we're going to show you today is called Cool Touch Laser. And Leah, maybe you could tell us about some of the work you're doing with this.
Sure. So far we've treated about just over 30 patients in our office and have had very good results. The results are subtle, not dramatic as with the erbium or the CO2 lasers, but we are seeing some nice improvement in the fine lines and wrinkles around the eyes and the mouth particularly, and also with patients who have some acne scarring. We're seeing some improvement in softening of those as well.
That's true. In fact, acne scarring is very difficult to get rid of unless you do something invasive, and now we have a non-invasive way to improve acne scarring. How many treatments do people have to go through when they do this?
It's a series of 5 treatments. They take about 30 minutes apiece, and they're spaced 3 to 4 weeks apart.
What does the patient feel as it's going on?
A sensation they've likened to just a brief stinging, and that comes from the cryogen, the cooling spray that comes before the laser. Most people tolerate it without any topical anesthetic, but we do have that available for them if they are too uncomfortable.
And what parts of the face do you do? Are there certain areas that are more popular than others?
Right now we're doing mostly full face treatments, but there are a couple of people that are focusing on the eyes or the mouth.
And when they leave the day of the procedure, the day it's done, do they look different? Is there anything bad that appears?
They might have a little bit of patterning, spotting, redness from the laser treatment itself, but that usually resolves within about 4 hours. They're able to put makeup on right after the treatment and go about their day.
Great. Well, maybe you could just show our patient what you're going to do,
Okay.
describe it as though you're treating any patient, and let's actually show our viewers what happens with a cool touch treatment.
Okay.
Good.
Jackie, you can put your goggles on. And I'm going to lay your chair back a little bit.
What are you doing first?
The first thing I need to do is, the laser is based on the temperature of the skin, so I will check the temperature of her skin and make sure that we have the correct setting for her.
So the laser handpiece actually has a device in it that will detect the temperature, and that'll show up on the laser computer itself.
Exactly. And we're going to treat Jackie's eyes, so I'm just going to move this just a little bit right here. Okay, I can already tell I need to adjust it a little. Okay, Jackie, here we go. 1, 2, 3. Okay.
So I noticed there was a material that squirted on the skin, and you saw the laser light flash. What's happening there?
That's the cryogen spray, and the cryogen spray acts as a coolant to cool the surface of the skin so that the laser doesn't damage the surface. And that fires just immediately before the laser fires.
That's why called cool touch, because you're cooling the surface of the skin. Again, the effect is then underneath the skin in the collagen, trying to tighten up the collagen.
Correct, exactly.
Why don't you show a few treatment now?
Okay. Okay, Jackie, I've got it on repeat. It'll go about 1 every second. Does that feel okay? Mm-hmm. Okay. Okay. The other side, just turn this way. And that would pretty much constitute a treatment for the eyes. It's relatively quick and relatively painless.
So that only took a couple of minutes, but when you do an entire face, it could take a half an hour?
Up to a half an hour.
Why don't we take those glasses off, the little things, and ask Jackie how it actually felt. What do you think? Was it painful?
No, it wasn't. Just a tiny little sting, but it's tolerable. Doesn't hurt really at all.
that's where that cooling spray comes in to do that, to keep that down.
Exactly.
What we're going to do is look at some pictures of before and after of some of our other patients that have had this done, and then we'll go on to see another technique today.
Okay, great.
What I'd like to show you now is actually the mechanism with which the laser is actually working to improve the skin, and what I have here is a diagram of the human skin, an artist's rendering. Obviously the skin is not this big, but what we're trying to show you here is the epidermis, the outer layer of the skin, and then the second layer primarily is the dermis, which is this large thick area. The outer layer really doesn't have much to do with wrinkling. It's the second layer that's involved with wrinkling. And when wrinkles occur, it's the collagen, which is represented here as pink material, that weakens, allowing wrinkles to appear. So what the Cool Touch laser does is it takes an energy level, wavelength, through the outer layer of the skin while the outer layer is being cooled by the cool spray. It's not being touched. The beam goes through the skin and heats up the water in the collagen layer, or the second layer, also known as the dermis of the skin. As it heats up this collagen, it causes contraction and shrinkage of the collagen that over a period of time that goes on for several months, even 6 months to a year, the skin continues to tighten and wrinkles continue to improve. I've got some photographs here of some patients who've had Cool Touch done. And what you can see in the first one closest to my hand in the upper picture are the typical wrinkles that we're trying to treat of the lower eyelid before, and then after you can see how those wrinkles don't show up. Again, in the other picture to the right, the lower eyelid, a lot of fine wrinkle lines, and then after, this is 2 months after 2 treatments, a lot of smoothing here. This is showing in people that have deeper wrinkles that you can get some improvement of deeper wrinkles. Again, the most impressive improvement would be with major laser resurfacing, the erbium or CO2, but that of course does have 2 weeks of healing and some downtime. But you can see before, the deep wrinkles are here, and then after, they're not as deep. The acne scar patient on the right, showing someone also that has dark skin, and this laser is safe for all types of skin, dark or light. We can improve the appearance of pores and acne scars before and after. This is 2 months after 3 treatments. The photofacial rejuvenation technique doesn't involve visible healing time. There's time involved in healing, but you don't see it. So people can have this procedure done for brown blotchiness, redness of the face and neck and chest and other parts of the body without taking time away from work. This machine that Leah is going to use is called the Fotofacial machine, which uses a technology referred to as intense pulsed light. This is a very high energy light that flashes into the skin and closes blood vessels and removes abnormal brown blotchiness without hurting the good color of the skin. And Leah, could you tell us how that works for patients?
Okay. In the patients we've seen so far, we've treated some for the sun damage and some for the rosacea, and we've seen excellent results in both. For instance, with the rosacea patients, we've seen positive results after 1 treatment, meaning that they've had a lot less flushing when the heat becomes intense, fewer breakouts from the rosacea. The sun damage, people have seen a much quicker evening of the skin, even tone to the skin, and they've been very pleased with the results thus far.
And so what do they feel as they go through this?
This can feel hot. It's a very quick burst of light, but it does feel quite warm. So most of the people do use the topical anesthetic with the Elemax, and it does takes the edge off. It doesn't take all the sensation away, but it is tolerable for them.
So let's do the treatment and let our volunteer Irene can actually let us go through it.
First thing we do is apply a little bit of this cooling gel. It's an ultrasound gel that acts as a conductor for the light as well as a coolant for the surface of the skin so that there is no damage to the surface. Irene, I'm going to count to 3, and then the rest of us will close our eyes on 3. 1, 2, 3. Is that okay? Mm-hmm. Okay. One, two, 3.
So what do you feel, Irene?
Just a little bit of warmth and then cool.
I I notice you're not jumping or flinching, so it must not be too bad.
No.
Otherwise you'd be yelling and hitting us right now, right? Not really. Now, she just blushed when I said that, so now we can use this to get rid of her blush redness on her face, too, okay?
Okay, and normally we'll do 3 to 4 pulses, and then we'll take the gel away and assess the skin to see what kind of reaction she's getting. So I'll do one more and we'll see. 1, 2, 3. And I'm not sure if you can see it on camera, but she does have a little bit more redness there to that area of the skin that was treated, and that's exactly the type of reaction that you'd want to see.
Again, it's important for anyone considering cool touch or photofacial procedures that a series of treatments is required to achieve the best results. These new techniques are not miracles, and they do not create perfection. These techniques offer our patients the opportunity to achieve varying degrees of improvement in their appearance of their skin. Since dermatologists now have such a wide variety of skin rejuvenation treatment techniques, it's best for the prospective patient to have a consultation to determine the best course of treatment for the individual, since everyone's skin is unique and offers different challenges in order to achieve the best results. If you'd like more information on any of the procedures demonstrated tonight or any other dermatology procedure, feel free to give us a call at Dr. Peppercorn's and Cox's Advanced Dermatology and Laser Center at 671-4182. That's 671-4182. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology, cosmetic laser surgery, and liposuction office here in Yuba City with your suggestions for areas and people that you'd like to see on this program. I'm always interested in hearing from you, and I hope that you'll suggest to your medical doctor or other healthcare professional that you'd like to see them here with me on the Medical Explorer. As you know, we are a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me here at the Advanced Dermatology and Laser Center at 350 Del Norte Avenue, Yuba City 95991, or you can check us out on the internet at our updated new webpage. That's just key into www.bestlasers.com and check us out on your computer.